Hope you're having a great day. Dr. Mike McPherson here, and I'm going to be showing you how to calibrate upper and lower body LOP with the Saga BFR cuff. Just turn my cuff on, press the button right in the middle. You'll notice it's completely wireless. The pump is attached to the cuff. The cuff is made of that moisture-wicking nylon, not going to pick up any sweat. Quick wipe down with the Lysol wipe when I'm cleaning it with different, whether it's patients, athletes, clients, everyone in between. The Saga Fitness app, it's free on the Apple and Android App Store. Super simple. I opened it up, I hit start. I turned my Bluetooth on earlier. You'll notice there's my cuff. I select the cuff. I can rename my cuff here, which I'm not going to do. Don't need to do that. But if you have multiple, you could. I'm going to hit Save Changes, proceed with one cuff, and then I can select arm or leg calibration. It's going to calibrate me in 30 to 45 seconds. Here's my cuff. I slide it to the most proximal portion of the limb. No matter what I'm doing, when I apply upper body BFR, doesn't matter if I'm working the wrist or elbow, the cuff always goes to the most proximal portion of the limb. When I'm doing lower body BFR, it doesn't matter if I'm doing knee, ankle, hip, low back, the cuff always goes to the most proximal portion of my leg at the top of it. I have my cuff on now. I'm going to select calibrate limb occlusion pressure. Cuff comes to life, and what I'm trying to do here is just nice and relaxed, keep my arms at heart height, and just let the machine, let the BFR tech do what it needs to do. It's going to inflate, similar to a blood pressure cuff, and what it's doing is sensing, there's a sensor in there that is feeling my pulse. Right, when that pulse is no longer picked up, that's what it marks as 100% limb occlusion pressure, and then it will provide that value. One of the most important things, and one of the reasons I love it, is it provides that value in millimeters of mercury. So just a little nuance. I'm done calibrating, right? There's my millimeters of mercury. Now I can recalibrate, or I can use that calibrated value. I'll use that calibrated value, and so it'll quick save that for me. So if it's my device personally, I only have to recalibrate as often as I see fit. If I'm using it with different patients or athletes, I'll have to recalibrate in between each one of them to get their own individualized limb occlusive pressure, which is the safest thing to do when it comes to BFR. You'll notice here, it gives me a recommended pressure at 50% LOP for the upper body at 76 millimeters of mercury, or I can set my preferred pressure. I can customize it. And that's where I can go up, right? I can go down anywhere, 26, right? Take it way up to 96, 100% LOP is achievable with this. I'll go to 50%, confirm pressure, come to this screen, hit begin workout. You'll notice it gives me my limb occlusion pressure, and then it's also going to give me a timer there. It'll let me know how long I've been occluded for. With, upper body BFR, we want our continuous occlusion at max. We're looking for 15 minutes, right? And then we want to rep effusive effect, take the pressure off for at least 1 to 2 minutes. And then if needed, you could re-inflate, but usually you're at that fatigue threshold and you've gotten quite a bit of that metabolic buildup and those BFR stimulus. Biggest things, key takeaways when calibrating the upper body limb occlusion pressure. Okay? Cuff goes in the most proximal portion of the limb. You want to make sure that each athlete has their own calibration. Okay, each athlete or patient, because everything, even on different days, that patient might have their limb occlusive pressure might vary slightly. If they started exercising, believe it or not, that limb occlusion pressure will vary as well. Cuff width, cuff size, cuff material changes the limb occlusion pressure, right? So you can't really compare a device to a device if their cuffs are made of a different material or if their cuffs are different widths. Wider cuffs are going to be able to use lower pressure, but they're going to restrict mobility. Narrower cuffs are going to enhance mobility, but you're going to have to use higher pressures in order to get the same level of occlusion. Sometimes they can cause, some of the 5-centimeter cuffs have caused some bruising when I've used them previously. The Saga cuffs, they're right in the middle, okay? They're right in the middle. We're looking at 10 centimeters, not too wide, not too narrow, a really nice balance of comfort and mobility, portability, those types of things. But that's it, right? Calibration, upper body, sit up nice and tall, arms at heart height. It's at the highest point of the limb, and just be nice and relaxed. If I'm moving, flexing, that'll disrupt the calibration.